Hello and welcome to another video. In this video, we're talking about insulin, high-risk drug. Insulin comes up quite a lot in your exam. It is high risk. The GPhC will always ask you questions on insulin. It is also a very common drug that we dispense every single day in the pharmacy. So here are 17 points to know for your exam. These are 17 key points I've put together to help you. Please know these points because they do come up quite a lot in the exam. Are we ready? So again, this is all about just GPhC exam predictions. We're not covering every single thing on insulin out there. We're not teaching you an insulin lecture. I'm literally giving you key points to help you build your foundation so that you can totally be confident and smash your GPhC exam. So here are my 17 key points to know for insulin that does come up. The first one is insulin is secreted by pancreatic beta cells. So they're made in the pancreas by pancreatic beta cells of the islets of Langerhans. It increases glucose uptake in terms of the mechanism of action. It's inactivated by GI enzymes. That's the reason why we give insulin subcutaneously or IV, but not orally. You need to know the three most common places where insulin is injected in the body, and these are the abdomen, the outer thigh, and the buttock, where you have enough adipose tissue, enough fat. These are the best places to inject insulin. So the abdomen has the fastest rate of absorption. So go for the abdomen. And then in terms of preventing any sort of side effects and ineffective absorption, we rotate the sites. Don't keep injecting the same side all the time. The reason is that because if you inject that side, then you damage the skin. You can cause what we call lipohypertrophy, which is accumulation of fat tissue, or you could cause even a more serious one, which is amyloidosis, which is a combination of fat tissue and scar tissue. So amyloid is a protein. Amyloids are proteins. So protein compared to lipohypertrophy, which is fat. Hypertrophy, it's easily reversible, but amyloidosis is not. Continue, mentioned that previously, when we spoke about sick day rules, you continue insulin during illness. And then an MHRA warning here is when you give insulin and a GLP agonist. So when you give these two together, say liraglutide and insulin, you have to, if you're going to stop insulin, it has to be very slowly. Do not stop insulin abruptly when you're giving it with a GLP agonist, simply because if you do this, you could increase the risk of diabetic ketoacidosis. So it has to be a slow reduction of insulin as opposed to an abrupt stoppage. Then we have this warning about withdrawing insulin from insulin pens and cartridges using a syringe. So you only use syringes to withdraw insulin from vials, but not from the pens or the cartridges, simply because they're calibrated different. And if you use a syringe and pull out insulin from a pen, you will get the wrong dose, which might either cause hypoglycemia, or hyper. So you need to avoid it. Then do not abbreviate to prevent the risk of errors. You have to write units. So international units and not just U. So it's not RU, you write international units on insulin prescriptions. And this has come up in the GPhC exam. So you definitely want to remember about prescriptions for insulin and for diabetics. Next one, number 10, we're looking at 4 millimoles. So this is where you have hypoglycemia, anything from 4 and below. But although we mentioned that you could have hypoglycemia at about 4.2, you can start having hypoglycemia if you look, that's in your BNF. But the normal figure that we normally use is 4, and anything from 4 and below is normally hypo. Then we have insulin passports. All patients have to be provided with insulin passports, which helps them record the insulin, more information about the insulin they're taking, and different aspects of the information about insulin. So they all need to have an insulin passport, and you need to make sure that happens in your reviews. Then we have what we call bovine insulin, which is cow insulin and human insulin. In your GPhC exam, they may give you a question. It might be an SPC question or a question with an extract where you have to convert from bovine insulin to human insulin. The main thing you need to know is human insulin is more potent, it is stronger, it is faster. So if you're going to give a patient from a bovine to a human insulin, you have to reduce the bovine dose. So you have to reduce the dose for the human insulin. Say, for instance, if you're giving 50 units of bovine insulin, you want to give them 40 units of human insulin because it is more potent than the bovine. So you have to reduce it by 10 to 20%. So that's the reduction you have to make from a bovine to a human, or from a human insulin back to a bovine insulin. Most of them can be stored at room temperature, and this is up to 28 days. So before you open insulins, they have to be in the fridge. But once you've opened that insulin, for most of them, they can stay for up to 28 days at room temperature. You have to avoid injecting cold insulin simply because it's quite painful, and also it's very slow in terms of absorption. Soluble insulin is one that isn't as common. However, it's important that you know, and we mentioned this when we spoke about diabetic ketoacidosis, the insulin that we use for emergencies, the IV for DKA, are normally soluble insulin. So you need to know that. Fiabs and Novarapids are not interchangeable. They're different brands. They're not interchangeable. So if a patient is run out of Novarapid, you cannot just decide you're going to give them Fiabs instead. Then finally, most biological meds in the BNF have to be prescribed by brand, and insulins are one of them. So most of your insulins have to be prescribed by brand. So rather than prescribing on prescription as Glargine or Aspart or Lispro, you have to prescribe the brand name Glargine instead. Say, for example, Lantus rather than Glargine. So how do we store insulin? That has come up as well in your GPhC exam. They really need you to know how to administer insulin, how to counsel on insulin, insulin storage. They can test you on any of these. So when it comes to storage of insulin, storage of unopened insulin. So before you use it for the first time, you need to store it at room temperature. Store it in the fridge between 2 to 8 degrees. Okay, 2 to 8 degrees. It cannot freeze. It cannot be below 2. It's normally 2 to 8. But this is before you actually open insulin. Keep it away from the freezer section. You don't want insulin to freeze because then it gets destroyed permanently. Do not expose insulin as well to direct sunlight or to heat. So avoid heat, avoid sunlight, and avoid insulin freezing. So, but once you've opened the insulin, then you can keep that out of the fridge at room temperature. So once open, you could keep it at room temperature between 15 to 25 degrees for up to 28 days. And with certain brands, you could even go longer. For example, with Lantus, Levemir, the long-acting ones, based on the brand, most of them could last up to 56 days at room temperature. Do not refrigerate after opening. So once you've opened, do not refrigerate after opening. Cold insulin can cause painful injections and slow absorption. So yes, you can keep it in the fridge, but if that freezes, then that can damage the insulin. Keep it away from direct sunlight and extreme heat. So these are very important. Another advice you have to give patients, they will come to you, the GP is going to test you. Patients that are diabetic are traveling with the insulin. So what advice can you give them? For daily use, they need to store the insulin at room temperature. For travel, use an insulin travel case or a cooler to prevent heat damage. Avoid leaving insulin in hot environments, cars, direct sunlight, and need to check insulin for any changes. Your insulin needs to be clear. If it looks a bit cloudy, and some insulins may look slightly cloudy, but most of the time, if that's not what it's meant to look like, it's meant to be clear, then you have to discard that insulin. So if it looks cloudy, if it's got particles in it, if it's becoming solid, if it's changed its color to something else, then you have to discard the insulin. So how do you handle insulin before injection? Do not inject cold insulin. There was, I think, a GPhC question about a patient that come to the pharmacy and that needed insulin because they're really suffering from hyperglycemia and they needed some insulin. And the only insulin you had in the pharmacy was frozen. Do you give it to them in that emergency, or do you get them to A&E or something urgently? I think the answer was definitely you cannot give them a frozen insulin because, again, that's damaged, that's destroyed, slow absorption, very painful. So you do not go for that option. So do not inject cold insulin. If stored in the fridge, let it warm up at room temperature for about 30 minutes before you actually use it. So what are the signs? How do you recognize if insulin has gone bad? So the way you recognize damaged insulin is it will be cloudy, unless that's how it's meant to look. But cloudy, you also have some lumps, so it could be clumpy. unless it's mixed insulin like isofin. But generally you get like cloudy or clumpy. If it's frosted, so it's crystals. If it's frozen, then you cannot use the insulin. Different color changes, such as changing to yellow, green, or whatever. Any color that's not clear, you need to discard that insulin. And if you have any sort of floating particles or any sediments on the insulin, then that means it's gone bad. You need to get rid of it. So it's so important you know this. A GPhC loves to test you on these things. Insulin is a high-risk drug. Every single exam, you're going to have a few questions on insulin, and some of those questions will be on this video, and others will be on the other insulin videos that we've covered. I hope this helps. I hope this is giving you a very, very good snapshot, areas to focus on in your GPhC exam, giving you some predictions there for your GPhC exam. All the best. Go out there and totally ace your exam. See you in the next video.